Um, so they are very helpless as I was handing someone a flyer, knowing it was never going to get followed up on, or that was there an understanding? Was there something that they needed later with a question? How are they going to navigate through all the information that is sometimes very confusing? So I myself have um, gone, like I said, with boundary issues. I have driven a student to the Social Security office. I have taken a student to get their state ID because there was no one else that could do that in their family. What has happened with Jessica? I brought some quotes from the staff that I work with. In my building, I work with 17 different special education teachers. I am often trying to help them learn so that they can learn often what to recommend to their families. When we invite Jessica or members of the navigation team to a meeting, we know that it's going to be clear. It's going to be helpful that the family can trust. So I brought some quotes from the teachers. I'm not going to read them to you, but they're on the slides, the next few slides. Most importantly, what I'd like to have you hear is we have found the mental health navigators essential to our school. We have found them a relief for us, a relief for the family. So it's really helped us with our relationship with the families too, because they feel like they're getting help on what are the next steps. They don't feel like we're saying, okay, your child is 26, they're done with us. Good luck. They feel like now that they have some place that they can call, that they can look into, that they will have help. Again, whoever came up with the title navigator was really thinking on that's what they've done for us. I have felt like it's been more fulfilling in my job because I know that I'm helping the families and that they're gonna be okay when they leave me. As a school psychologist, you might say to me, Paige, what is your caseload? We don't have caseloads as school psychologists. Right now, I serve 1,200 students that if they call me, I need to be able to help them get what they need. And those are just in the 3 buildings that I serve. Anyone in my district could call. So again, as school psychologists and school social workers, our job is to really focus on the special education law, making sure the students are getting their special education services. And I don't know what we would do if we didn't have the navigators. Our levels of mental health concerns have increased over the last 8 years. Our students, specifically with autism spectrum disorder, often we say if you've met one student with autism spectrum disorder, you've met one student with autism spectrum disorder. The needs can be so variable. So again, having somebody that is familiar with all the programs that are available in the county, all the services and how to get them has just been invaluable and has made my job much more rewarding. My family want to say thank you. I hope to represent them in expressing the gratitude we feel for the program existing. We feel it is essential. I made a little graphic that's on, I think, the 3rd slide that just shows some of the words that, not from me, but just from the 17 teachers that I work with, expressed about the navigators and the ability they've had to make our jobs easier, more rewarding, and we just think they're essential members of our team. So I wanted to say thank you again.
Not only that, but even if I can add too, when coming from working in one of the provider agencies before I became a mental health school navigator, if you're not familiar with where the Huron Valley School District is, that's like that northwestern quadrant of Oakland County. So we're talking Milford, Highland, White Lake, and a good chunk of Commerce Township, where this is not an area that sees a lot of service providing agencies, not just like our core providers, but just like counseling offices or career readiness programs, not even just like the MRSs or like the state agencies, but just any kind of service agency, vocational skill building, anything like that. This is not a very highly served area for services to begin with. So for us to be able to reach out and start providing that, so hopefully maybe even with us having more of a presence, maybe that'll help bring more of a need or maybe more agencies to come out to that area as well too. That's my bigger hope and dream with our connections.
I'd be happy to speak anytime or give anybody further information on how the navigators have helped us. If anybody has any questions or needs me to give any other feedback specific, I'd be happy to.
Please, thank you for sharing your experience and those of your colleagues. And first, I think on behalf of the board and everyone here, thank you for what you do for our children and for their families. Many of us on this board have been through this experience, and it can be a very daunting task to face the future. But if you have people that you can trust and know what they're doing and know what the options are, it makes it a lot easier for families to make the right choices for the young man or woman that they're is in their family. So thank you very much. Just so everybody knows geographically, where are the Huron Valley schools?
So I specifically work at Milford High School in Milford, but we cover we have more busing than I think anyone in the state because we cover Milford, Highland, Commerce, White Lake. So we're over in like that's beside kind of on the edge of the county.
Right. So I knew that, but I just wanted to make sure everybody else knew where you were from. But that's I think sharing what you did. We don't always hear the impact of what fund and what we do and support, and it's good to hear that. And it gives us, I think, a lot of confidence that the right thing is being done, especially. So, do any board members have any questions for Paige or any of our folks, Jessica?
Yeah, thank you for this presentation. I have a son who has gone through the public education system, and I remember how difficult it was to access services, let alone accessing. We didn't even know that what was available or what he was entitled to. And I'm, in my medical training, I had done all kind of research. Of course, we had Index Medicus in those days, which are tomes of volumes. But so thank you for all the work. My question is this: is this part of the transition plan, especially for post-high school students who have to be prepared for the outside world? Is it part of their transition plan where they are connected with the services? And what is the process of that? Is it done through the IEP or?
Yeah, so part of our requirements in special education is to make sure we're planning for all transitions, whether it's secondary education, training, mental health services. But again, often where I was lost in my career was talking about it, handing a parent a flyer, and then not having the staffing or the ability to give specific answers and or help them navigate which program option or service was the best for them, or signing them up, being able to do the follow through, and again, helping the parents who maybe are impaired themselves, kind of more hand holding. While I would say to people, I'm here to help you, I call follow up. But again, we were kind of losing that personal touch and having somebody who knew about the Medicaid and the Social Security and all those types and could directly sign up and get people right into the agency. And again, help them, again, I'm just going to keep saying the word, navigate through it at any time when they had questions.
I had, excuse me, 2 questions. What with the school navigators, about all of the Oakland County schools or just certain districts?
We make ourselves available for all the public, private, charter, virtual schools. You call yourself a school, we will be there available to support you in any way. Now, some schools are more receptive and supportive of our program over others, but that doesn't mean that we aren't ready to support anyone that reaches out to us looking for assistance.
So if there was school professional that wanted the assistance, is that calling Access or how do they?
They can start with Access, of course, because there's never a wrong door around here. They can start with us. We do have our own group email and phone number line that they can reach out to us as well too. Easy thing is the school navigator at oaklandchn.org, that emails out to the whole team and our manager as well as Trudina. So that's the easy way to get a hold of us, to start there if needed.
Okay, and then my final question is, you talked a lot about the ATP program, but looking at like the whole spectrum, would you assist with like ECSE where families might not be, early childhood special education, where families maybe don't know of services that could be available to them? Yeah,
Absolutely.
thank you.
I went to middle school to help out a colleague who was, again, boundary issues on my part, who was having some medical issues and immediately knew what to refer to at the middle school. I haven't worked in preschool in a long time, but again, we've had Jessica and the other navigators, Adele, come out to all levels in here.
Thank you.
And not only that, but we've also done our community outreach to OCHN and grandparents raising grandchildren, meetings and presentations with them as well too. And I know school districts are still holding preschool programs that, of course, they know that they can reach out to us to help with that testing and navigating that initial IEP process as well too.
Thank you so much. I remember when I first moved to Michigan, somebody said when I was trying to learn this area, go to Huron Valley's transition fair to learn about services in this area. I didn't even know we had valleys in Michigan, but it was wonderful. And so thank you for everything you've been doing that was over a decade ago and throughout. I guess my quick question is, when families are transitioning from school to community mental health services, what is their biggest fear and gaps that you are seeing that we as a board and as an organization could help better address?
Twofold. In my district, one is transportation. We don't, we have, it's an increase and it's become better, but again, that's one thing that we always struggle with is how to get to things. So we have been, like that resource fair that you're referencing, part of what we were trying to do is bring resources into the families, into our area, because as Jessica said, we're in a geographic location. I think the other huge concern we're seeing is the mental health, well-being of children right now, and for even summer vacation, I'll use as an example, but what is going to happen if my child, when I pass, is what my parents of the students I work with will say. What's going to happen next? What are the next options for somebody taking care of the mental health of my child when I'm no longer there as a parent?
Anything else?
Question that I have, and first let me thank you very much for this presentation. I've had to deal with that as a pastor in a church and blah, blah, blah. But the question that I have, I think you mentioned at age 26. And I think you just about answered the concern that people have after that. And that is a big concern. What other options can we offer, services we can give? Because I think that after that age 26, that parent is very much concerned. You know, what happens if something happens to me? Where do I go? The benefit of having a one-on-one early on is very good because they can talk to you about their frustrations, anxieties. But what happens when you step away?
I think often also what comes up is housing concerns and also who do I call now? Who do I call now that the school might not be part of my team? So again, that is something else that comes up.
And another thing, once they, I think that's the benefit of connecting with the mental health school navigators and getting them connected to services, such as our IDD providers, because after 26, okay, school that post-secondary is done. However, there is CLS support, there is respite support, and it's, and I'll again use my, job training. I'll use my daughter, for example, she's 28. what extra support do I need to have for her to live a meaningful life like any other 28-year-old? So that may mean she can go out in the community, but I may have a CLS worker. And then we look at what is necessary for them to do that, whether it's a few hours a week, whether it's a few hours a day, but to make sure that they have that meaningful life. So they can still do things after 26, or they could continue in different programs where they continue to work on their independent skills.
And I think that's a nice thing too about starting this, building this bridge and connection now while they're still in school. So we're introducing a supports coordinator, we're introducing these CLS direct care workers while they're in school so they can start attending these IEPs. The students can start building this relationship, start planting the seeds of trust with these new individuals while they still have the trust and this bonded relationship with the school psychologists, their school teachers that they've known for quite some time. So while they are kind of transitioning out as school staff, they know that they're going to have still that case coordinator, that supports coordinator that they're going to be seeing on a regular basis. They're still going to have those direct care workers and probably seeing them more as that time in school starts to lessen for them as they transition away from it as well.
Well, again, thank you very much for Jessica and Priscilla. Please take our thanks to the Navigator team. It's always great to get this kind of response and this kind of participation. And thank you to Huron Valley Schools for their participation. So we thank you for coming tonight. You can stay for the meeting if you want. You're not required to, but thanks for coming. Now we'll move on to the rest of the regular agenda. First, my report is very simple. We are facing unprecedented challenges in funding from the state. We also don't talk about it too much yet, but we anticipate there will be some changes in Medicaid this year, perhaps. So we are monitoring those situations, but we are also taking action, and I've been working with Dana and the team on outreach to our legislators and others in the county to address these issues. First of all, make them aware, but also to come up with solutions for the future. So that's pretty much my simple report. I also want to state that I did at the meeting last month ask the board or challenge the board to perhaps consider going to the local community and with our mental health awareness proclamation that we sent out to all the communities. And I am going to be on the agenda in Royal at one of their next two meetings, so they haven't decided which one. But so if you need any help with that, Suzanne knows her way around the municipal world and can help get you hooked up if you don't want to make the call yourself to the city manager or township supervisor or whatever. But I think it's important for us to get out there a little bit and let people know who we are, and also the importance of mental health awareness in May. So next we have the financial update given by our CFO, Robert. The floor is yours.
Good evening, everyone. Thank you. Welcome to our new board member. So I'm going to go over the financials. Our challenges, I think I'll lead off by saying our challenges continue. And also our opportunities and our efforts to confront those challenges continue. So the first slide is going to go over the trend in our monthly payments or Medicaid payments from the state. And I did take the liberty of actually identifying the dollar value for each of those bar charts. You can see that between October and February, it's a fairly steady decline from about 34.2 million to about 32.6 $1.3 million, about $1 million change over those 5 months. And we've talked about on a number of occasions that transition from folks out of DAB and into less fully funded categories, and that also continues. Next slide is going to talk about our eligibles, and that trend also is slightly downward, though not quite as pronounced. And we're hopeful that trend adjusts over time, but as of right now, that contributes obviously then to our financial challenges on the revenue side, because we're paid on the number of eligibles. Our capitation is driven by that. So, and next slide, please. Moving to our balance sheet. Overall, you can see a little bit of a switch from the end of the year to now. Pardon me. Our cash is up and our receivables are down. Overall, our liquid assets are slightly down relative to where they were at the end of the year. And that just means that we collected some money sooner at the end of February than we did at the end of September. But it also represents that decline in overall assets represents the change in our overall financial picture. It's represented by our revenues earlier. Next slide on the liability side. Our vendor payables are up by about $10 million. And those are payments to providers predominantly. And then our overall net position, you can see that we're down meaningfully, I would say, relative to the prior year, that 29 million versus that 19. Our next slide is just going to talk about our revenues. Overall, our Medicaid revenues are up despite that downward trend from the beginning of the year. So that's certainly a good thing. But when we look at our expenses on the next slide, you'll see that they're also up and up a bit more significantly. We could go to the next slide. And then finally, just taking a look at our net income, you can see that we're showing a deficit of about $8.2 million, which demonstrates our financial challenges, but also demonstrates the fact that we are pushing out money to the people that need the services that are being delivered. I'll pause there and ask if there are any questions about the financial graphs at this point, and then we'll take a look at our providers and the actual financial statements.
Any questions for Robert?
So Robert, just to clarify, on the payables, there's a difference in 24 million. Am I reading that right?
Yeah, from prior year.
Okay. And that's predominantly in the mental health IDD services.
Yes. And we'll see that on the financial statements.
Thank you.
All right, the next slide just shows our top 15 providers. We track this over time. I've mentioned this on a couple of occasions, but at some point in the near future, the bars for Easter seals and Mork will be combined. And it's going to definitely represent them as our single largest provider in a meaningful way. And then there's just a description of those top 15 providers and a little bit about how they're funded and what they provide. And then the next slide, it's a little bit small. So hopefully this is in the packets, but it's an overview of Statement in net position, what's commonly known in the for-profit arena as our balance sheet. We can take a look at the change in our overall assets and liabilities that was depicted a minute ago on those slides. And we can see in the column under unaudited February 28th balance that change in our bottom line to 19,783,000. The other thing that I typically like to point out is our current ratio, which is the percentage of our current assets to our current liabilities. And it's slightly more than 1-to-1. So still certainly stable, but we'd like to see that ratio improve, ideally. And then the next slide is our statement of revenues, expenses, and changes in net position, or the income statement in for-profit language. At the committee of the whole meeting, one of the questions that was posed was about midway down the operating revenue section. There's a line that says CCBHC settlements. And the CCBHC settlement is the difference between what we have identified as T1040s, the code that represents the PPS payment to the CCBHCs, what we represent there as what we should have gotten, and the actual cash that we've collected for those T1040s. And so that difference is posted. We are owed roughly $258,000 for the CCBHC component or this. So that's what that settlement is. It's just grossing up the revenue number in the anticipation of getting that cash. And again, you can see the $8.2 million deficit under the change in net position in that fourth column, year-to-date total activities. Earlier, Mr. Young, you had asked about where those liabilities were coming from, and you can see that the significant majority of our expenses is in that mental health and IDD line on the expenses.
Any further questions? Robert, I want to thank you. Clearly, we're still facing this challenge, and because we still have high demand, our providers and those we work with have high requests that correspond to that. But we're not getting the money from the state to distribute. So that's why we, again, are still in this tough situation. And until we get relief from the state, that's going to continue. But there will come a tipping point at some point in the future. So we'll save that discussion for another day.
I do want to acknowledge, if I may, I think that the transition to fee-for-service that we're undertaking is going to certainly help, but it is not a solution to your point. It's not a solution to the fact that we are fundamentally underfunded.
Right.
And we are doing our due diligence in terms of looking at opportunities to manage our cost.
We thank you for those efforts and those you're working with. All right.
Thank you.
I'm sorry.
Maybe more for Dana. So on the eligibles, and we talk about this every meeting, I think, but any progress from the state in terms of the miscategorization of, those who were disabled in 2020 and in 2024, they're no longer disabled.
Well, we're working on that on several different areas. One is working with CMHA, the Community Mental Health Association, because it's not just the issue that hitting Oakland County, it is across the state. The other thing is that working with MCHS, identify those cases where we see the change in categorization, and it goes back over a series of years. So still haven't come to a hard solution or response because of everything else that is also going on. But it's something that we consistently put in front of that group as well as the PHPs meeting together and the CMHSPs, and those meetings talking about what are our strategies to address it. And right now, with everything going on, I think it's going to be a hard push to have some resolution to that. But we're going to keep trying to see if there's anything we can do, even if we can't go back, even for now. How do we make those adjustments and make sure that people are properly in the right funding category as it relates to Medicaid? The fear is that these Medicaid cuts are going to continue. What that means is that we'll be in a situation, and I believe Mr. Thorne is also speaking to this, is that we're only going to be able to serve the individuals who are the most vulnerable and most needy in our community. And we know that a lot of the prevention programs and the programs that are working include everybody. So we don't want to be in that situation, but we do have to think about how do we manage those limited funds with who we need to help.
I think, Robert, just great information. And with what our board chair has mentioned to us, and we're all aware that there may be cuts, you know, and I think it's not a maybe. We anticipate those cuts. You made a statement, and I know our chairs made that statement as well. Even though we're working at this level, we've been able to maintain services a lot to meet a lot of the needs. I'm wondering, with the anticipation of whatever the cut may be, love to say that the state will give us the money we need, but with the anticipation the cut will be, do we have a crises team sitting saying, okay, what happens, or what will our service level be if we 10% cut, 100% cut? It sort of prepares us for the inevitable that's going to be coming down the pipe in relation to the service that we're giving and what, because we've really done a lot, even though we're working in a deficit. But anticipating that deficit would be even greater, what type of services can we maintain that's so critical? This is a group that just spoke to us about that funding. How do we make sure of that? And I don't know if we have a crisis team that's looking at that from your viewpoint as far as the financials to say what and how.
So my best answer to that is that we've got a dedicated executive leadership team that talks about contingency planning at virtually every meeting. It is top of mind. It is a constant conversation. And I would say that that's where the conversation starts and where the planning, and I think I can say this, like the weight of those decisions really rests. But we're engaged throughout the organization with our IOPS teams and our clinical teams and utilization management, and everyone is working to understand that and to be prepared for, on a contingency basis or for what may come. I would also acknowledge that there's just vastly more that we do not know tactically and strategically than what we do, but what we have at our disposal, we're putting to the best use. That I can assure you.
Yeah, Mr. Smith.
I just want to follow up on John's question real quick on the eligibles. If somebody in our provider network or families or feel like somebody is misclassified, who should they bring that? Whose attention should they bring that to? And do we have the resources here to help get them in the right category?
Can I answer that? We have our customer service team who is always ready and available to help people with that. And then also we're able to take a list of names and people to the state and bring that to their attention. The problem is in the middle. So when you're working with the Department of Health and Human Services, thank you, and they're making those determinations, like we can identify there are at least 200 males in their 20s who are put on Plan First, which really is a family planning benefit and has absolutely no mental health coverage. So what we have to do with those individuals is most people don't even know that they're in the wrong category. There's a really higher level of information that people don't see on their cards. But when we see it and we've identified it in our reports, we're able to take that and say, this is an error. But the time it takes to correct those things and get to the right person, that's where we see a lot of the challenges. And so the more cuts we see and face, the less we'll be able to really navigate that, because the people who are supposed to help with that aren't available. So we're working through that. We have our Citizens Advisory Council. I think I'm saying it right. Citizens Advisory Council, and we do a lot of education. The members of the community are big, huge part of that council and talking about those challenges as they arise. So there's a lot of support when you call our access team, which Tradina just is the leader there. There's help there if they find that. So everywhere we see it show up, we're trying to address it. If our UM department encounters somebody and they're looking at it, they don't necessarily look at insurance, but they look at what the person is receiving to make sure that their benefits cover those services.
Nancy, the Chief Information Officer at OCHN. I just want to be clear on something here. The way all what Dana said is absolutely true for the people we serve. But the way we are funded is we are getting funded for every Medicaid eligible. We are not touching every single one of them. So those who are receiving services from our providers, we can work with them, but we are getting funded for someone else who never was part of our network. So we can't do anything with this.
Thank you, Ron. Appreciate your efforts and the information provided. Next item is actually our procedure file. We did cover at our committee of the whole meeting last week needs assessment process. And the first linchpin of that was a feedback survey that talked about our organization's strength, identified areas for improvement, and then to help us determine priorities to include in our 26-28 strategic plan and 25-26 strategic plan. So we're not going to go over all that again tonight. Francis is here to answer any questions for board members who weren't here and an opportunity to look at the documentation. But we're going to have a continued dialogue with you and others on the team as we put together the plans for the future. And obviously, I think we would talk about perhaps touching on some of that at our study session this month on the next week. So that being said, is Francis, thank you for coming. Thank you for all the efforts in putting that feedback survey in a form we could understand. Yeah, and so it's always good to get the feedback, understand where the families and our consumers are at. So does anybody have any questions for Francis? Anything that needs to be added, Francis and Trish?
Could you just remind us when the annual plan will be presented? I believe it's in June and the strategic plan in September.
Well, in terms of next steps, so as Mr. Cohen referenced, we provided the full report of the needs assessment with the board packet, so you can refer to that for some additional detail. And then in terms of the next steps, the May study session is when we will be providing some additional information, and that will also be an opportunity to go through the needs assessment and the strategic planning, some of those high-level goals to help OCHN and the team narrow down what the priorities are for the next 3 years. From there, we are looking at August, I believe, for the final annual plan, but that will be a period of time. So through June, the rest of the summer. And so we will be also bringing some of these initial recommendations and conversations to the board as well, and, bringing everybody in to provide feedback.
Thank you. I think we're good. So we'll just receive and file. No vote if necessary. We'll look forward to continued dialogue on our future plan. Next, we have website development administration. Suzanne? We did cover this matter last week, and the finance committee did approve it or did make a recommendation for approval to the board. Go ahead.
Good evening, everyone. Suzanne Weiner, Director of Communications and Community Outreach. Chris McMetrick, Director of IT, is also going to join me as well. He's a integral part of our new website. As you can see, we are seeking to get a new website for OCHN with a new vendor to a new contract totaling $115,153 and some change. This will be an opportunity for us to enhance our digital presence with our website, increase some of our accessibility, improve our provider directory presence, as well as some of our training enhancements.
Any questions for? If there are none, then we'll have a motion for approval. Any discussion? I think it's a good thing that we try to improve access. And we do have some deficiencies that I know are being corrected, and have an opportunity for those who are looking for services to find that type of access in the court. So it's like the efforts. Any other questions or comments? Roll call vote, please.
Mr. Young?
Yes.
Mr. Furman?
Yes.
Dr. Giles?
Yeah.
Pastor Jones?
Yes.
Dr. Guadalupe?
Yeah.
Ms. Woodruff?
Yeah.
Dr. Hans?
Yes.
Ms. Newman?
Yes.
Ms. Root? Mr. Smith?
Yes.
Mr. Cowan?
Yes.
Motion carries.
Thank you very much.
Thank you.
Let us know when the rollout is. So we know about it. All right. Next, the recipient rights advisory committee member appointments. Vicky, thank you. Go. I came right up. You were ready.
On it.
You're on it.
Because
Yeah, we did have a recommendation of the policy committee for just two individuals. You want to give any comments? Oh,
Yep, so the Recipient Rights Advisory Committee did interview two individuals for our two open positions, Diane Sansalone and Melanie Hager. And both were acceptable candidates, bringing a lot of advocacy and lived experience and a variety of skills that will be beneficial to the Recipient Rights Advisory Committee.
thank you. Thank you, committee, for their efforts. So I think we should we have to do them separately. So first, for the nomination and appointment of Diane Sansalone.
So moved.
Support.
Any discussion? We did all receive information regarding the applicant, and I think follow the recommendations of the committee. There being no discussion, then can we have a roll call vote, please?
Mr. Smith?
Yes.
Ms. Root?
Yeah.
Ms. Newman?
Yeah.
Dr. Hans?
Yes.
Ms. Woodruff?
Yes.
Dr. Guadalupe?
Yes.
Pastor Jones?
Yes.
Dr. Giles?
Yeah.
Mr. Furman?
Yes.
Mr. Young?
Yeah.
Mr. Cowan?
Yes,
Motion carries.
thank you. And next we have Melanie Haber, nomination and appointment.
Make the motion.
Motion, support. Is there any discussion? Roll call vote, please.
Mr. Young? Mr. Furman?
Yes.
Dr. Giles?
Yeah.
Pastor Jones?
Yes.
Dr. Guadalupe?
Yes.
Ms. Woodruff?
Yes.
Dr. Hans?
Yes.
Ms. Newman?
Yes.
Ms. Root?
Yeah.
Mr. Smith?
Yes.
Mr. Cowan?
Yes,
Motion carries.
thank you. And Vicki, please let Diane and Melanie know that we appreciate their service to the community and to people we serve.
Thank you.
Thank you. Next is our consent agenda, which is a number of board and committee minutes that are to be approved.
Move for approval.
Motion
Board,
on the consent motion, there's no discussion. All those in favor say aye.
Aye.
All those opposed, the motion carries and those minutes are approved. Next, we have board reports, Recipient Rights Advisory Committee, Dr. Guadalupe.
So our last meeting was held on April 3rd. During that time, we continue to go, we're going page by page in the rights booklet, which has been very helpful. We had some updates from the just overall rights department. They are working on hiring some rights specialists. There was an ARC event where Judy Summers and Elizabeth Martin were recognized and received awards. And we had discussion on those that were completing their terms with some openings that we just voted on. So we had interview and discussion on that. And then the committee wanted to make sure some of the concerns were brought up to the board, one of which was the overall future of Medicaid changes and just that it's making families and community members, consumers uneasy, not knowing what's going to happen in the future of Medicaid. Secondly, the decision to move for a fee for service. They're feeling that some providers are going to be unable to meet standards and potentially those providers might end up having to close down. When that happens, it's going to impact obviously individual lives, and they're just concerned about the relationships and the trust that have been built with those agencies. So, and then the third was with regards to transportation allotment, that a lot of times there is not enough money in the transportation allotment to allow individuals to support their goals and plans, and putting burdens on families financially having to help support the individual's goals when they don't have the money to support those financial needs. I don't know if there's each month they come with certain concerns that they want brought to the board. I don't know how we want to go about sending a response back if that's the, you know, like, so far I don't know that there's been a ton to come back, but this time I think there's a conversation like that. So response would be helpful.
I will give Vicky to follow up on individuals or those situations that you bring to our attention for sure, so that we can, even if I need to go back to the next meeting and actually respond to those concerns, we can do that as well. And if you have individuals' names, then that's also very important, so we can have our customer service team directly respond to those individual needs and concerns.
Yeah, I think this time it was collective, like things that people were hearing from the community that they.
Thank you.
Thanks.
Thank you. Next, the Citizens Advisory Committee, Christina.
Thank you. Our previous CAC meeting was held on March 19th. We voted to cancel our September meeting this year to respect the scheduled Walk a Mile in My Shoes rally. And then we also had our COO Trish join our meeting, and she presented the annual needs assessment. Our next meeting is actually tomorrow at 9:30 a.m. Thank you.
Thank you very much. Thank you for those reports. We're going to have a slight change in our agenda. We do have to go, at least it's been recommended to go into a closed session as allowed under state law on a particular item. And so we're going to move public comment in the director's report 8, 9 in front of 7, and then we'll come back. Okay. So at this time, if there's opportunity, second to public comment, I wish to address the board, please state your name and please limit your comments to 3 minutes. Do we have anyone online, or are we not able to reach anyone?
We can see them. And we can hear them if they talk.
But maybe put something in the chat, just asking you.
If you are able to hear us online and wish to speak for public comment, please raise your hand at this time.
Right. Anyone in the audience who wishes to address the board? being, there's no one, but we thank those who attended this evening and coming to our meeting. So at this time, I'll hand it over to our director, Dana Lesby.
Thank you so much. Good evening, everybody. And again, I just want to remind everybody, this is World Autism Acceptance Month. And please join us in lifting this year's theme, Celebrating Differences. So I'm really proud of our team. We all get together and celebrate each of the monthly things that we see, but also the proclamations and things of that nature that our board members are willing to take to the various neighborhoods and communities. We are really proud of the work that we're doing. And so you can see our room is really full with our team, our leadership team, chief and directors. And so I want to tell them thank you publicly for showing up. Honestly, they do the tremendous work. I just sit here sometimes and I'm just amazed at the number of things that we do. But also I wanted to show too the commitment we have and the engagement we have for advocating for this community. And so it's just not me and Trish and some of the others that you see from time to time, but it's the whole team that is represented here. And not everybody can attend the evening sessions, but I wanted to make a point and I want to thank our team for being present today. Also, we celebrated today, this morning, we have 4 pending retirements. So we had an amazing celebration this morning. I just want to read their names. And some of them don't like the attention, but they deserve the honor and attention for the years of service and dedication. So the first person I really want to acknowledge is Victoria Marble. She's been here 30 years. And so she's not with us this evening. This morning, the 4 ladies are they're not retiring. They're going to new adventures. We're all represented with their crowns and their sashes. So Victoria was working in the CEO's office, and I'll tell you, she and Sheila together are a dynamic duo, and we're going to miss her tremendously. Her and Sheila talk on the phone, probably even on the weekend, every single day to make sure things are running smoothly. So I really appreciate Victoria, and if she's listening, I want to thank her for amazing service and dedication to OCHN for 30 years. The second person I want to acknowledge is Angela Costello. She is an employee who worked in customer service, but even before that, she is a social worker who worked in the community advocating for people served. And so the customer service team is going to really, really miss her. I'm not even doing her the service or the justice she got this morning in terms of the accolades and warm messages she received from the team. So we want to wish her the best. And she was the main one telling me she's not going to use the R word, that she was going on for new adventures. So we're excited for her. The third person is Glenda Weatherspoon. And Glenda is not here with us right now, but she was also here this morning. And Glenda is our HR manager, we all know. But Glenda has been here, I think, 15 years? I'm trying to remember. But anyway, we remember Glenda probably most in the last year for this board, in that she stepped up to be the interim HR director. And she did a tremendous job, even though sometimes she didn't want to come and present to you all because it made her a little nervous. She did a tremendous job, and some very tough things came up during her time in that position. But just overall holding that team together, and everybody sees her as a great support and mentor, and she's a calming force. So most people don't know, Linda is also a veteran. So we really celebrate her service to this organization as well, and the impact she's had. So probably one of the biggest ones that you've seen, our little Energizer Bunny, Miss Christine Berg is also leaving us after attention, so we won't make her cry like we did this morning. But we're really going to miss Christine. Again, she is a action to be reckoned with. Anything that needs to be done, she's stepping up and she's pushing and she's stretching us. And sometimes I'm like, Christine, I don't want to do that. And she's like, you're going to do it. You'll be okay. You're going to do it. So she's impacted probably every single department within this organization and every provider, the legislators, and she's just really going to be missed. But we're going to use her advocacy skills and call on her. She told us we could call her, but she might regret that. But we really are happy for all of our 4 adventurous queens that'll be enjoying their time off, and hopefully they'll sleep in and get some rest, or they'll get up and do all the fun things they want to do. So I just wanted to acknowledge that, and that is a huge part of my report. But the more important, well, not even more important, there's other things that are going on, but we really wanted to take this opportunity to spend and celebrate them, and really have the whole team there. The room was full this morning, so it was a great celebration. I hope they enjoyed it. So some of the other things I want to just talk about extremely quickly is I had an opportunity through a recommendation through the county deputy exec, Medea Tariq, to work with the Middle Eastern satellite television channel. And so it was really a great opportunity to talk about mental health services in that community. Well received, welcome. So you're able to see that interview I did about a month ago, I believe. And the information is in my report, so you can actually pull it up and watch that. So it's really important that we reach communities that we often don't reach, and we hope to, but having that opportunity really, I hope, brings people to OCHN or within our network to get services and supports they do really need. And I learned that from working with that organization. And they are widely reaching a whole audience of people I had no idea, and they're right here in Troy. So that was a great opportunity to improve access. The other thing is I did provide a quarterly update to the Board of Commissioners last week, and it was well received. And what we really did this time in our report is highlight those collaborative activities and programs that we're doing together, like the School Mental Health Navigator that was put together actually at the time when Rudy Hobbs was working as a deputy executive for Oakland County. And we saw children coming back to school, away from the virtual world, actually coming to school. We said, how can we help these families navigate and get the services and supports they need? So it's amazing to see the outcomes. And this program has really grown. We started with 2. And I think, how many do we have now, Tradina? 7? Mm-hmm. 4. Well, I'm hopeful. So really, this is a program, again, when we look at funding cuts, this is probably one of those programs that is at risk. So it's not covered by Medicaid. It is covered by grant dollars that we work with the county to receive. So we know we have at least another good year, but we want to look at ways that we can ensure that sustainable based on the feedback we received today and the feedback we've been receiving over the last few years when we started this program. The other things that we highlighted also have to do with our response to the crisis, the tragedies in our community, in terms of our team developing those critical incident stress management skills and being able to support the community when something tragic occurs. Of course, we never want to see those things happen, but to be able to respond to this community in need is really critical to what we do, and it does help with accessing those services with our network of providers as well. The other things are working with the law enforcement community through our co-responder program with the clinician that rides along with the police officers, as well as the 1,500, well, I'm really pulling my numbers off there. Our 1,200 law enforcement officers that have been trained with crisis intervention team training under Trisha's leadership has been phenomenal. The response that she and Dr. Posio get in terms of the behavioral health threat assessment and management, working with the FBI, and those kind of programs, again, could be at risk without the appropriate funding. So those are the things that are not necessarily Medicaid covered, but those are the good community benefits that are part of us and our role in this community. So I really want to stress those points. And it's due to the collaboration we have with the county and the schools and all of our partners, of course, our provider partners, where we're able to work together and resolve some of the things that we see that are barriers to accessing good care. So we want to make sure we continue to work on those things. We had an amazing night on Saturday. A few of us, at least 8 of us, attended the NAMI Honors Night in NAMI, Michigan, under the leadership of Kevin Fisher and the work that he's doing throughout the state, but also our own NAMI of Oakland with Thank you. I saw him in his beautiful wife that night. But I'm also very proud to say we nominated Senator Rosemary Bayer, and she actually won the award for legislative, what is it, Dr. Covia? Legislative award, the full name is not here, but she was recognized for her work and her advocacy for the mental health community. And it was great to see so many people who are truly committed to this work be honored and recognized. We have several peers, several family members that were recognized, even providers that were there, and also a member of the Community Mental Health Association was recognized for her service for over 30 years as well. She's going to retire too. So finally, I do want to talk about some of our other advocacy and programs that we're trying to expand and receive funding is to really make sure that our crisis continuum is full and comprehensive so that people have options in terms of where they go and when they're seeing for crisis services, or even preventing full-blown crisis and doing some of the urgent care that we're doing with the walk-in center and honors health, along with making sure our assessment center here in this building is expansive and meeting the needs of the community. So we expanded that assessment center so that we can see families who are in need of the diagnostics for autism, but also looking at other comprehensive assessments and evaluations we can do to connect families to those needed services and supports. So with that, I will stop and see if there's any questions.
Question? Yes. Dr.
Not a question. I just want to make a comment since it is highlighted in here. Congratulations to Dr. Kozias. It looks like he was inducted into the American College of Thinkers. So congratulations.
Thank you for that comprehensive report. That's a glad we will have a wonderful event for women who have played an influence on not just the organization, but on families and lives throughout Oakland County. And we appreciate their service. That being said, we now come to the end of the public portion of the meeting. We are going to, after the vote for a closed session, assuming it passes, we are going to leave to go to another room. And as soon as that session is over, we will adjourn. So that this will be the end of our public portion of the meeting. So at this time, our legal counsel has requested a closed session pursuant to Michigan compiled laws 15.268 1H8 to consider an attorney-client privilege matter. So I need a motion and support. Support. Motion and support. Vigorous motion and support. Now we need a roll call vote.
Oh, okay.
Mr. Young.
Yes.
Mr. Furman.
Yes.
Dr. Giles.
Yes.
Pastor Jones.
Yes.
Dr. Guadalupe.
Yes.
Ms. Woodruff.
Yes.
Dr. Hans. Ms. Newman.
Yeah.
Ms. Rue. Mr. Smith.
Yes.
Mr. Cowan.
Yes.
Motion carries.
Okay, we adjourn the closed session. Thank you all for coming.